So today we'll discuss regarding the a death due to throttling. So before we discuss regarding throttling, so first we should know what is strangulation. So strangulation is a form of violent asphyxial death caused by constriction of the air passage at the level of neck by means of a ligature or by any means other than suspension of the body. So there are common methods of strangulations. One, if it is a ligature material like rope or any other materials like sari, we can use by that constricting the neck by the ligature. We are telling that it is ligature strangulation. Sometimes we are using this our hand. We are using in a manual form, that is called manual strangulation, or sometimes we are telling it's a throttling. There is other form also. One is banchodola, mugging, and garroting. So strangulation by ligature you already discussed. So throttling is the strangulation by hand. Banchodola is the strangulation by two sticks or rod. Garroting, if we are strangle somebody from behind without warning, that is called garroting. And mugging is strangulation by using the knee bend or elbow bend. If you go through the causes of death, the most important causes of death is combined asphyxia, combined effect of asphyxia and venous congestions. Along with there will be asphyxia, cerebral anoxia, or venous congestions. There is possibility to get vagal inhibitions, and a very rare possibilities fracture dislocation of cervical vertebra. So come to the throttling. So throttling or manual strangulation is application of external pressure on the neck by hand, and here the motive is always homicidal, or the manner is homicidal, and where the suppose if there is no intentions to kill, but there is chance of attempt for rape to silence the victim, or sometimes to prevent cries of the victim, there is chance to obstruct the air passage by hand, and that is called manual strangulation or throttling. So what are the causes of death? If you observe, mainly due to the causes of death are asphyxia, or sometimes due to stimulation of this vagal receptor causing vagal inhibitions. What we will get in the external findings if we are doing post-mortem examinations? On the external findings there is bruising of the neck. Why there is bruising of the neck? Due to the constrictions by the assailant finger. There is possibility to get scratch abrasions due to nail, circular red color bruises 1 to 2 centimeter diameter on both sides of the neck, bruises of thumb which is more prominent on one side, and small bruises on the other side. When both the hands are used, bruising and scratches depends upon the way both hand used. Bruises and scratches over the face, lips, nostrils, chins and cheeks also we can observe. There is possibility that sometimes there will be scratches due to the assailant, and there is bruises also by the use of the hand of the assailant, and the shape of bruise may not correspond with the fingertips of the assailant. Due to there is fighting or struggle and resistance between the assailant as well as the victims. So on the internal finding, what we will observe? So when we are dissecting a body, especially for in a dead body, on the neck we should go for a bloodless dissections. So first we will dissect the cranial cavity, then abdominal cavity, and the last we will go for the neck dissections. On the neck dissections, extravasation of blood in the tissue underneath, these bruises as well as abrasions, nail mark abrasions, what we observe externally. There is possibility because of this struggle, there is chance to get laceration of the muscles of the neck. They are both platysma and sternomastoids muscles. And also there is chance to get hemorrhage in the mucous membrane of larynx, pharynx, epiglottis and base of the tongue. There is possibility to get fracture of the thyroid cartilage, especially on the supercornue of the thyroid. And if there is fracture of the hyoid bone, that is the bone of the neck, then it is most diagnostic finding. So this is a case where she observed there is lacerations, bruises, extravasation of the blood in the laryngotracheal passage. The most important bone on the neck, if we are getting fractures, most commonly we are telling it is throttling. But this hyoid bone fracture is very rare if the age of the person is less than 40 years. So more common in a person of age 40 years, and it is due to fingers grasping hand squeezing the throat, causing a posterior fragment of greater horn of the head compressed inwards and causing a inward compression or adduction fracture. So extravasation detected around the fracture site, and fracture can occur on both sides. So this is the hyoid bones, this is the greater horn, lesser horn body. So most common there is fracture of the greater horn, and it is inward compression of the fractures, that is called adduction fractures. This is the laryngotracheal passage having these hyoid bones, the thyroid cartilage having superior horn and the lesser horn. So there is possibility to get also some fracture on the superior horn of the thyroid cartilage. On the internal findings also, in other organs we will observe only congestion of the lungs. Blood is dark in color and fluid, and there is possibility to get taddeus spot on the pleural surface, and all other organs remain congested. So these are all about the throttling and the external and internal finding to give an opinion that the cause of death is due to throttling. Thank you.